I am a pediatrician, and I spend my clinical time evaluating children in whom a concern has been raised for abuse or neglect. The concern is usually raised in a medical setting by a medical provider who's working on the front lines, has identified a concern in a patient. I enjoy what I do, but the topic can be a very tough one. Part of what keeps me going on particularly difficult weeks is the research that I conduct. I am interested in child maltreatment prevention, and this is the focus of my research. The reason I find this research topic so interesting is that it entails going upstream to where maltreatment begins. As a pediatrician doing clinical work, I spend a fair bit of time on the downstream end of things, managing the aftermath of violence and neglect. Spending some of my research time upstream means that I get to think about ways in which we can keep certain risky situations from turning into abuse or neglect. And instead of looking at child maltreatment one individual case at a time, I get to look at how system changes can impact a larger group of children or families. That's what public health is all about. In thinking about how to prevent child maltreatment in all of its various forms, it helps to think about the child or infant's environment. Who do children spend time with? Among many others, they spend time with their parents, extended family members, other caregivers such as daycare workers or babysitters, teachers, coaches, pediatricians. These are all people who frequently see infants and children and are potential targets of maltreatment prevention. What I mean by targets of a prevention intervention is one of three groups of people. The first group are the people who are at risk of maltreating children and can be given tools to keep that from happening. Programs developed in this vein include those that teach parents about normal behavior and development. These programs help parents and caregivers better understand what their children can, and perhaps most importantly, cannot do, to give caregivers better understanding of to minimize their frustration and reduce the likelihood that they will abuse their children. The second group targeted by prevention efforts are the people who need to know what signs to look out for when children are maltreated to keep a situation from escalating and to report to the authorities if needed. These programs often entail teaching doctors or teachers about the signs and symptoms of abuse and neglect, such as a broken leg in a non-ambulatory infant, and what to do if they suspect maltreatment. And the last group targeted by prevention efforts is the children themselves. Several programs have been developed, for example, for schools to teach children about their bodies and personal space, to try to prevent sexual abuse of children and increase early disclosure when it does occur. But in thinking about ways to prevent child maltreatment, it's important to remember that children are impacted by people and things well beyond their immediate environments. I just mentioned some examples of interventions that were specifically designed to impact child maltreatment outcomes. Now, I'd like to talk about policies and how they might impact child maltreatment. Familial poverty is an example of a risk factor for child maltreatment. Growing up in a family of lower means does not mean that a child will be abused or neglected, but it does mean that that child may be at increased risk when compared to one from a family of higher means. Policies and programs aiming to reduce this poverty have been proposed as a way to reduce the child maltreatment that sometimes goes along with poverty. The Earned Income Tax Credit is a benefit for people with lower incomes, especially those with children, which reduces the amount of taxes that they owe. It has been shown to reduce poverty. It has also been shown to be associated with lower rates of certain types of maltreatment in a couple of different studies. Other risk factors for child maltreatment that have been proposed as targets for prevention include parental mental health issues, having lots of young children in the family, employment instability, low educational attainment, limited access to childcare, and limited access to health care. When I was in my first year of the Health Services Master's Program, I was in a health systems and policy class. We spent quite a lot of time talking about the Affordable Care Act, or Obamacare, or the ACA, and its Medicaid expansion, which allowed many more adults to qualify for Medicaid, thereby impacting their access to health care and improving their financial stability. In our discussions, it dawned on me that because some of those adults who now qualified for Medicaid were parents, there was a possibility that the Medicaid expansion might have had impacts on their children as well. In a study we published this year, a team at Seattle Children's and the University of Washington looked at the 2014 Medicaid expansion. Because Medicaid expansion wasn't required as part of the Affordable Care Act, several states opted not to expand their program. This allowed us to compare the change in rates of child neglect in the states that did expand to the states that chose not to. And what we found was that the states that opted to expand Medicaid had on average fewer cases of neglect than the states that did not expand. This suggests that even though Medicaid was not a program that was developed for the specific purpose of preventing child maltreatment, or child neglect specifically, Medicaid expansion might actually serve as a means to do that very thing. So for our discussion time, I'd like you to think about what policies and programs might already be impacting child maltreatment and how we could expand them to do that even more effectively. Thank you.